All right. Good morning, brain turns. It's so exciting to see the participants, like the numbers go bloop, 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 bloop. We're seeing so many of you joining right now. Thank you guys so much for joining us again for day 2 of our Brain Turns webinar series. We're going to get started in a minute because we have 2 amazing women in neurosurgery joining us today. We have Dr. Soriaya Motivala and Dr. Ronit Gilad, both from Northwell Health. And they are very, very busy. They actually are taking time out of their day and their schedule to work, to speak with you today. So we just want to, before we even begin, say thank you so much for joining us this morning. Dr. Motivala is going to be giving a presentation about women in neurosurgery, and then we will open up the floor to Q&A. So if you have questions, please post in the Q&A. I will enable the chat right now before we begin so you guys can chit chat. We do ask that you keep the chat respectful and professional. If you start to crosstalk or engage in unprofessional or inappropriate language, we will disable the chat function for the rest of the webinar series. So do not do that. We want to make sure you guys can chit chat with one another and connect. So without further ado, it's 9:00 a.m. I'm going to pass the spotlight to Dr. Soriaya Motivala. Thank you so much for joining us today.
Hi, thank you, Hannah. Thank you for having me. Hi, everyone. I'm Soriaya Motivala. I'm the vice chair of the neurosurgical department in Staten Island University Hospital, part of Northwell Health. And I am very, very fortunate to work with my exceptional partner and chairperson, Dr. Ronit Gilad, who's actually joining us from her family vacation in Denver. So she is going to be answering some questions as well. And we'll chat a little bit about, sort of how she mentored me and helped me really experience a fabulous neurosurgical career. Also, potentially joining us later is Dr. Jamie Ullman, who is the director of neurotrauma for Northwell Health. And she's been a wonderful mentor to myself and Dr. Gilad for many, many years. She is doing an emergency surgery right now, a trauma surgery, and she will join us as she can. So Hannah, if you want to click on the talk, we can get going. All right, so I've given this talk a few times, and I got asked to talk a little bit about being a woman in neurosurgery for a diversity session that Lenox Hill was having several years ago. And it was really pretty reflective for me. I go about my day and my career and it's just normal. But there are so many women who came before me to make this normal. Because as you are probably aware, this is not a career that many women were ever encouraged to. In fact, they were discouraged from joining over the years. And it's so gratifying to see the change in the landscape. So I'm going to talk about women in neurosurgery, less than a minority. One of the very first female neurosurgeons we can find on a record is Sofia Ionescu. She was Romanian. She was born in the 1920s. And she very much, joined medicine when women were not allowed to be physicians, let alone surgeons. And she was credited with being the first woman to perform a neurosurgical procedure in about 1944. And she became a full-time faculty neurosurgeon around the 1950s. And she really, really came to this by accident. Next slide. So what happened, that's my camera balls. What happened is she had this sort of decisive moment, and I feel very much kinship with her. I feel like I had a decisive moment with a male colleague that sort of pushed me into this career that I never would have thought possible. So she was working kind of as an intern with a professor who was unable to operate due to a wound on one of his fingers. And under his tutelage, but out of necessity, out of an emergency, she performed a life-saving craniotomy for an epidural hematoma on a young boy. And at that point, that male physician was able to see her skill and her ability. And this led to him mentoring her into her career. And something very similar happened to me when I was a medical student. A pediatric neurosurgeon by the name of Daniel Fulkerson sort of identified that I would be someone who could practice this sort of career, and really encouraged me. And I never thought of it for myself. So I think there are these moments in time that are really inspiring, and how cool that, you know, this happenstance led to her becoming one of the first women neurosurgeons. Next slide. So she had a career of over 47 years. 25 of them was head of the tumor department, 22 head of spinal pathology. And she's credited with a lot of technical advancements for our field in academic research. And she was a mentor and an educator, but she was also a wife and mother of 2 children. And I think that's very important because, you know, for a lot of us, we don't want to have to choose. Next slide. One of the other, you know, pioneers for women in this field was Diane Beck. She practiced from 1902 to 1956, or was around from 1902 to 1956. And she established a neurosurgical practice in Middlesex, England. For 31 years of her career, she was actually the only female neurosurgeon in Western Europe and the United States. So for decades, there really was only 2 women practicing this craft, which is, you know, remarkable. And that brings me to Dr. Ruth Kerr Jacoby here in this country. She was the first female diplomat of the American Board of Neurological Surgeons. This is our accreditation board. So she was the first female board certified neurosurgeon and in this country, and that didn't happen until 1961. So you can see the really long fight women had to become accepted into this field. Next slide. And a bunch of other firsts. Dr. Alexa Kennedy, she was born in 1950 in Lansing, Michigan, and she was the first woman and first African-American to become a neurosurgeon in America. She got her MD at the University of Michigan. She did her residency in neurosurgery at the University of Minnesota. Graduating in 1981, she was chief of neurosurgery at Children's Hospital in Michigan in 1987, and held the position until her retirement in 2001. So you can just see there are these long spans of time for us to make progress. And I thought this was such an inspiring quote of hers. I was worried that because I was a Black woman, any practice opportunities would be limited. By being patient-centered, the practice growth was exponential. So she just did the work. She did the work in the ethical, patient-centered way. She knew how, and had a very strong career. And I think that's such a lesson for all of us, you know, even in the sort of harshest of environments. If you just do the work, if you just put your patients first, if you just care about what you do, you will be successful. Next slide. And so that brings me to us today. And you can see, I thought this was really amazing, from the first ABNS certified female neurosurgeon in the 1960s. And this brings us into the 2000s. You can see our growth was really stagnant through the 60s and 70s, started to take off a little bit in the 80s, and then really ramped up in the 90s and 2000s. So where are we today? In 1965, females represented only 9% of medical school enrollees. Currently, we're at actually more. We're at like 51%. But we only make up 15.8% of all neurosurgical residents and 6% of all board certified neurosurgeons. We also have a really high attrition rate in neurosurgery residency, where we've had historically of women, which has been about 17% as compared to 5% with our male counterparts. So while we're making a lot of progress, you know, a progress in neurosurgery is not sort of following the same progress as entering medical school. Next slide. So what are we doing wrong still? We're doing a lot of things right, let me tell you. I mean, where we are now compared to where we used to be. I mean, there are residencies where whole cohorts of classes are all women. And that's just amazing to me. I mean, that certainly wasn't anything we ever thought was possible. And we're seeing much more women in roles of leadership than we ever have before. But there's still a lot that we have to get better. We still have, way fewer women in leadership positions than men. We have a lack of mentoring because of that. There's also historically, the traditional neurosurgical training had limited or lacked any flexibility for having childcare, being able to have children, take care of your children, all of that. There's still a huge financial disparity between female neurosurgeons and their male counterpart, on order of about $100,000 annually a year for the same job, same training level. And there's also some very antiquated attitudes that still exist towards our very significant contributions in the workforce. Next slide. So we are, this is a couple years old, but at the time, we still only had a few women in academic leadership positions. For the longest time, the first and only female academic chair in neurosurgery was Corinne Maraska over here on the right. And Dr. Maraska, she's a really amazing person. She's the chair of neurosurgery in Michigan, and she's also the chair of pediatric neurosurgery. Dr. Maraska not only is a woman in a career where it's mostly male, but she also is a person with disabilities related to her dwarfism. And I read an article not too long ago, people were interviewing her, and somebody asked her what was harder, being a disabled neurosurgeon or a female neurosurgeon. And without missing a beat, she said it was much harder to be accepted as a woman in neurosurgery than a disabled person in neurosurgery. And that was really quite telling to me of how difficult it's been for a lot of these women to make progress. And very only in the last decade was she joined by Linda Liao at UCLA. So, for years, the leadership of departments has been largely male. And that does lead to sort of differences in the way we're mentored. And I think, these women have been pioneers. We're seeing more of this happen across the country. It's very exciting. Next slide. This is just a few of the female professors in full professors in neurosurgery. This has been something that's been very challenging for us to make headway. One of my mentors, Isabel Germano, is up on the left corner, and she very much struggled to get the respect in these leadership positions that she has earned. And so from there, we're seeing more and more women slowly but surely attain this rank. Being a full professor is a very important academic title. And it was largely relegated to the realm of men, but we're seeing some changes there as well. Next slide. We've only up until very recently had one in any of our professions. Shelley is right there. And you have to think about how long these have been around, 100 years. And it took 100 years to get to one female president. So still, it's been a long haul, but we are starting to see some movement there, and that's very exciting. Next slide. And I just want to, my partner, Dr. Gilad, is on, and I want to pay some credit to her. In this area, in the New York area, she's one of the only women chair of a neurosurgical department. There are 5 neurosurgeons and about almost 20 ACPs who work for her. And she has been a great inspiration and mentor to me as well. And she has done a really amazing job at expanding our program. And it's all very exciting to work for someone like that. And I think we're going to see more and more of that happening in programs across the country. And it really, really helps to drive the needle in innovation and in quality of care. Next slide. Both Ronit and I were very fortunate to have other women mentors, and I think that has a lot to do with our success. This is Dr. Ullman, who is supposed to be on with us today. She is a full professor of neurosurgery. She's the director of neurotrauma for the Northwell Health System, the director of quality for the Northwell Health System. She's had the title of being the vice president of the CNS. She's a former president of the Women in Neurosurgical Group of the AANS. And, you know, she has taught and mentored many, many male and female residents over the years. And I think that she has instilled this idea of quality, of compassion, of, you know, sort of being open-minded of how we care for patients. And certainly she's moved the needle in how we take care of the traumatically injured patient across the country and even in the world. And so I think that for me, having people like Dr. Ullman, Dr. Gilad, Dr. Germano, really showing me, you know, what women can accomplish in this field through very tough times. And each of these women has gone through a harder time than I've had to go through to attain my goals. They laid the groundwork. And it's, you know, very, very important for our story to look back and see how these women came up and then keep moving the message forward. Dr. Ullman's been a tireless champion of women joining this field. And I know she's responsible for a lot of women becoming board certified. She helped me become board certified. And I think we have a responsibility to the next generation. Next slide. So that touches on what I think is one of the profound issues for women joining this field is a lack of mentoring. So I'm very grateful to have this opportunity to talk to all of you out there. If I can encourage you to follow your, you know, career dreams, whatever they may be, if they're neurosurgery, if there's something else in surgery, you know, I want that to happen. The more we have women in these fields, the more it becomes just, you're just another surgeon, not a woman surgeon. And that's what I'm really looking forward to. Next slide. And you know, having a lack of workplace flexibility within neurosurgery, a lack of affordable, available childcare, really does limit your ability to advance in this career. You know, maternity leave remains 68 weeks of most institutions. Going back to a residency where you're already not sleeping and to have to perform is really tough. And I know for me, I was pregnant at the end of my chief year. I had my twins when I was a new attending. And honestly, if it wasn't for the support of my partner, Dr. Gilad, it would have been a lot different experience for me. So I was very, very fortunate to have her to be able to support me through this, because I don't think everybody has had that opportunity. And so, you know, let alone, you know, having the time and space to have a baby and recover from doing that, the, you know, sort of the work week requirements for graduation becomes difficult. The lack of support once you're back in your residency for things like if you want to be pumping, childcare emergencies, that's really, really tough. And the other part of it is because of all of this, women in medicine on average incur 20 more hours a week of parenting time than their male counterparts. So that's 20 hours where you're not able to write papers, do more surgeries, do more research, sleep. You know, that's important too for your success. And so that does set us back. You know, resident salaries also are pretty low, and childcare is prohibitively expensive. So it makes all of this quite difficult. Most facilities don't offer childcare. And so if you don't have familial support, it's tough. You know, if you don't have the financial means from a partner to help with this, it's very tough. And they don't do a good job of making it easier. I do think some things are starting to change. Some programs are starting to change and to have more flexibility, but certainly there was none of that for Dr. Ullman. There was none of that for Dr. Gilad. I was fortunate enough to work with another woman neurosurgeon who made it possible for me. Next slide. And then we talked to about the financial inequality. We're talking massive pay gaps, you know, massive pay gaps for female neurosurgeons, $90,000 to $100,000 per year, less on average. And there's still similar pay gaps in vascular surgery and even cardiology. I mean, it's just not an equitable playing field this day. Next slide. And so we talk about discrimination. Discrimination is becoming more and more subtle. It used to be overt. You know, a very famous chair of a neurosurgical department told my partner that he would never train a woman. I won't say who it is. Now, no one would dare say that, but there's, always little comments in the interview process that happen, sexist remarks with coworkers and patients. I can't tell you the amount of times I walked into a patient's room and they've thought I'm the nurse and my elderly ACP is the physician. All of these things happened. You get passed over for things, for jobs or positions. It's just sometimes you don't, nothing is being said, but that it's wrong, and that still exists. I think it is much better than it has ever been, for sure.
Oh, I'm sorry.
And then there's the, imposter syndrome that happens to us, that we just don't think, we're good enough. And that's a very common thing for women in many, many high-powered professional careers. We are always worried that we're being judged. We're always worried that we have to be better. And we are way more likely to point out our own flaws and undervalue ourselves. We undervalue ourselves when we go to ask for a salary. We undervalue ourselves when we go to ask for a promotion. And oftentimes we won't even do those things. And so that's really tough. That's something that I've been learning how to deal with. Next slide. Because, as you know, I don't know if any of you saw this Harvard study. I think most people have. We actually are better at taking care of patients, as it turns out. The mortality rates for patients when we're caring for them are lower than our male counterparts, probably because of this self-reflection, probably of this concern that we're not doing good enough for them. We don't take it for granted. So, we are not even listening to our own data. Next slide. So the AANS, which is our neurosurgical body, wrote this white paper in 2017, and they looked at neurosurgery residencies, and we have been increasing, but we recognized there was finally recognition that this was a problem, and the AANS put out that we should be doing things to improve this. It took until 2017 for them to write that paper. We've been having these societies since the early 1900s, so it has been very slow, but I feel like at this moment in time it's really picking up, which is really, really encouraging. Next slide. And so just a little bit, there's been a lot of people who supported me through this. A lot of women. Dr. Burwald is the chief medical officer of my hospital, Dr. Gilad. But also, a lot of the heads of the neurosurgical department in my particular department have been very encouraging. And Dr. Langer, Dr. Shuba, and that's been great. You can see some of my conflict of interest there. That doesn't have much to do with this talk, but I do teach for a number of technology companies. And that's also something that's been exciting because traditionally women weren't asked to do this. So next, thank you very much. And I think Hannah has a ton of questions for me and Dr. Gilad.
Thank you, Dr. Motivala. If I can just make a few comments. Great talk as always. And I'd like to personally thank you in helping me develop in my career, because it goes both ways. It's not just the mentor and mentee. It's working together allowed us, I think, to climb the ranks the way we did. And it was the support from both ways. So as much as you thanked me today at this talk for giving you support, you've given me equal, if not more, support for my career. So I'd like to publicly thank you for that. The second thing I wanted to say, just to piggyback on how I see things really improving over the years, is I've gone throughout my career, I've gone to multiple courses to just try to stay up to date as far as surgical skill and new innovations and technologies that have come up. I like to stay up to date, so I've gone to many courses. And I want to say that up until 2 years ago, I was pretty much the only woman at these courses. And I've noticed in the last 2 years that there's really been a rise in young women neurosurgeons who participate in these courses. And this last February, I went to a course, and I'm listening to these younger, new attendings, women attendings, talking about other women attendings in the country, that what they're doing, how they're being promoted. And it was just a beautiful thing to listen to. So I am noticing that and I'm enjoying it.
Thank you. So Hannah, I think there's a bunch of questions. I don't know where we should start, but we're ready.
Yes, no, and again, I want to thank you so much, Dr. Motivala, for that wonderful presentation. She actually has a case to get to, so we're going to try to get through as many questions as we can. And thank you again, Dr. Gilad, for joining us from your vacation. It's supposed to be your time off, yet you're still taking your time to help inspire and mentor young aspiring female healthcare professionals. So thank you again for joining us. One of the questions that I had seen, how do you deal with microaggressions when you do face them in your practice?
Oh, so that is, I don't want to say I ignore it, but to some degree I ignore it. And I just know that it's misplaced, and I know that I'm doing the best job I possibly can. And I would like to say that most of it comes from a place of insecurity and inadequacy of the other person. And that's what I remind myself, that this is not my problem, this is your problem, right? And that's the way I look at it. And that helps me to not let it get in my head that there's something wrong with me. And it's taken me a long time. I'm a people pleaser. I think most of us are. I really want people to like me and to feel good about me, but that's not always going to be the case. And most of it is their own unprofessionalism and their own inability. A lot of that here I had found was amongst the older surgeon set, the older hospital administration set. I don't find those from people of my generation to a large degree. And I think it's because most of the men of my generation are so used to training with women now, that there was never women that they trained with before. And now there's women that they trained with, there's women that are partners with, and they tend to look less at you as, you're a woman in neurosurgery and just that you're another surgeon. And so that's been good. And so to a degree, I sort of remind myself that part of that microaggression is that these older, gentlemen, these misogynists, as it were, are living in a time that is mostly gone, right? It's the time of dinosaurs. And I remind myself that all the time, right? And I feel sorry for them, honestly. And that's the way I deal with it. I just go about my way in the most professional manner possible. And so far that's worked. And some people may say, well, are you avoiding it? And I don't think I am. I just think it's ridiculous and you're not worth my time. That's the bottom line.
And I have another question. This is more so about the pathways to, I'm going to kind of combine a couple of questions. Yeah. What advice do you have for young women with the goal of becoming a neurosurgeon? And the path, the questions keep moving because we keep getting more. Who might be discouraged, and do you have any advice in terms of what they can do to help them along their journey, and where can they find mentorship?
Well, so that is a really great question. I think so much of this journey is, one, you just have to believe in yourself. And two, finding really good mentors, people who can inspire you and help you to figure out whether this is the right thing for you. One of the ways we can do that is certainly when you make connections like this. I am always happy to answer emails. Hannah can give you my email, Dr. Gilad's email. We're happy to answer emails. But also through Lennox, we have a program for young people to come join, to shadow, to be part of our research programs. And Hannah can obviously help you with that if you message her, but there will be a program in your area. So go and look at the program in your area and look and start emailing people, ask, call the department. Do you have any volunteer opportunities? Do you have any research opportunities? I mean, as simple as so I grew up in a very small town. And I ended up finding a connection with one of the hospital pathologists of all things. And I just, called them up and asked if I could come volunteer. And that sort of started me into sort of seeing what it was like to just be in medicine and to be in the hospital. And it was like a connection I got from my dad. He knew this woman from 20 years ago. So you will be amazed at what you can find to move yourself into the medicine space. Most people are, super excited to have young, eager people come and learn from them. And so you can find these opportunities all over the place. Just get into your local hospital, get into your local neurosurgical program to volunteer, and it'll help you also know that this is really a career for you. And even if you don't know anybody, you get on Google, find people in your area. There will be emails online. Do not be embarrassed. Send out an email, see what you can catch.
So I'm seeing in the chat, I don't have any connections. I just put a link to the Women in Neurosurgery website. And this is a forum for women in the neurosciences to gather and to discuss all of these issues. And I highly encourage you to visit the website and see if there are any female neurosurgeons in your area that you can ask to shadow or just, have a conversation with. Because again, like I think having those mentorships, and it's really important. Like Dr. Motivala was saying, her mentors helped her get to where she is today. So I highly encourage you to look on the Women in Neurosurgery website. It's neurosurgerywins.org. We got some questions about family planning. So this is a question that we've kind of fielded before in our Women in Neurosurgery webinars, but is there a good time to have a family? Like, do you do it during residency or do you wait until after you're done with residency before you begin your practice? Like, when is a good time to have a family? And did people look down on you for deciding to have a family and to have children?
So the answer is it's never a good time to have a family. So you just have to pick the best time for you. Okay. One of my colleagues, Dr. Mari Groves, who has done multiple fellowships. She's a pediatric neurosurgeon. She's a pediatric surgeon. She works at Johns Hopkins. She had her children during her residency because that is what suited her, right? For her life, for her parents and whatever. I waited a little later. Dr. Gilad had hers after residency. Dr. Ullman had hers very late. Sort of suits you because it is never easy. And that goes for any career you have. And there's always going to be challenges, but I encourage you to do what's best for you. Okay. Second, the answer to your question is yes. Did I get some blowback, some pushback, some shaming when I got pregnant? Yes, I did. Mostly from very much older male neurosurgeons that were looking at it as something I did to them to make it difficult for them, which is crazy because I had nothing to do with them. But I also got a lot of support, and I got a lot of support for some very, very strange places. I remember very much this older neurosurgical attending, one of mine who never would have thought would be that kind of supportive. He's kind of rough and all these things. And when I found out I was pregnant, he walked in and he told me he was so excited for me. He said, "This is going to be the best thing you ever did." And he was very supportive. And that surprised me. I never would have thought that. So you never know what you're going to come up against. But a sort of administrative colleague of mine at the time came to me when she heard me apologizing to my chair about getting pregnant. And she came to me and she absolutely yelled at me. She reamed me a new one. And she's like, "How dare you apologize? You have every right to do this. Don't you dare ever do that again." And that really helped me. You don't need to apologize. This is your body and you do what is right for you. Okay. And the rest will sort itself out. It's not going to be easy, but none of this is.
Thank you so much. We have a couple questions about programs. Do you have any are there certain programs that are more geared towards women in the US specifically? I know that you're more well versed in the med schools here in the States, but
yeah.
Are there programs that are specifically geared towards women, or is it kind of a mixed bag?
So I would say that when you're looking at programs, if it's a program that has never graduated women, doesn't have any women faculty, probably that's not going to be the most supportive place to start. Overall, in this country, in the US, I feel that there are very few programs that have that deep misogyny rooted in them anymore. Very few. Most of them have become so mixed. The drive for diversity is pretty significant in neurosurgical training right now in this country. But I really, really do think, for me, I applied for a wide net when I was looking at programs. And then when I got my interviews, I got a feel of it. Things that were like red flags for me is one program, the only female attending, who's like a very successful, very talented woman, was really in the interview with me, was saying negative things about some of the other women residents she trained. And that was a little off-putting to me, like, oh, you don't sound so supportive, so maybe I won't come here. And then programs where if you want to have a family and you want to have a social life and a personal life, and this is across the board, and I tell this to the male residents, if you're in a program where everyone is single, chances are the program is so harsh that you can't have a personal life. You might want to reconsider unless you don't care about having a personal life. Or if you're a single person and you're in a program where everyone is married, you may not feel like there's anyone who you can be part of. So I looked for those programs that had a mix of people to accommodate all sorts of needs, personally, as well as the kind of program professionally I'd want to be trained in. And there's a lot more out there than you think. Most programs are a lot more accommodating now, especially now, than they used to be. So I think those were things that I looked at when I was picking a program. Obviously I don't know all the programs in Africa and Europe and things like that, but I think those are good rules to look at. Look at who's been trained there, look at who's currently training people there, and it should give you a good idea if this is going to be a good place to go to.
Amazing. I'm going to ask one more question just to make sure you have enough time to prep for your
Sure.
case. And I'd love to hear Dr. Gilad's answer to this too, but why did you decide to pursue neurosurgery and become a neurosurgeon?
I could call myself the accidental neurosurgeon. I know that sounds crazy. But I did not, when I decided to go to medical school, neurosurgery was not on my radar. When I was in medical school, I actually had decided I wanted to be an OBGYN, believe it or not. But then I did my OBGYN rotations and realized I did not get joy delivering babies, not even a little bit, but I wanted to be a surgeon. And then I decided on plastics. But I had an opportunity to do a neurosurgical rotation for 2 weeks. And that's when I met this really inspiring neurosurgery resident. He's now a pediatric neurosurgeon in Indiana. And I remember being in a case and he handed me the craniotome. It's a drill that we use to drill holes in the skull, very basic instrument of neurosurgery. And he's like, you can do this. And it was so cool. And it just blew my mind. Dan Fulkerson. Yep. And somebody asked, and it just blew my mind. And he was like, you can do this. I was like, really? I never thought about it. It was supposed to be a rotation where you can show up in the morning, go home, after an hour of rounds and still get an honors, which is why I decided to do it, to be lazy. And then I found myself there every night until midnight, staying overnight. And for 2 weeks, I just absorbed it. And that's really how I ended up in this career. And it is like a challenging career. Sometimes it's a heartbreaking career. Sometimes you question yourself, but I've surrounded myself with really, really great people, male and female surgeons, inspiring people. I feel mission driven. I feel purpose driven. And that's what gets me up every day in the morning. And you need to find that for yourself. You find that, and even the hard times are good.
Amazing. Dr. Gilad, I know.
Hi.
I know
I'm
you're
still
in a different
here.
time zone too. So again, thank you so much for joining us.
You're welcome. And I have family members also coming in and out, and but it's okay. It's quite all right. For me, my story is I was always interested in neurosciences. And when I entered medical school, I had my heart set on neurology. But then as I did rotations and as I did surgical rotations using my hands, I like taking things apart, putting them back together, kind of thing. I started dabbling with the idea of a surgical specialty, but I still loved the neurosciences and still had neurology on my mind. And I went to NYU for medical school. And during my third year, one of my rotations, I just happened to walk into Dr. Wissoff, a pediatric neurosurgeon at NYU. I walked into his OR and he was resecting a pineal tumor from a child. And the anatomy back there is just spectacular, and seeing it in real life under the microscope I said, okay, this is it. This is what I want to do. And I never looked back. So
Well, we're so grateful that both of you chose this career path because you're truly incredible at what you do.
There was a lot of questions about what if I live in a small village? What if I don't have access to people? We're such a global society now, and the internet is totally revolutionary and amazing. If you are living in a small village, but you have access to the internet, you can certainly reach programs about doing some research, some paper writing, because you don't need to physically be there to interact. You can interact with mentors via Zoom. You can do lots of things. There's so many opportunities. And, we have different pathways of getting here. Dr. Gilad is very modest, but, I don't think we mentioned that she managed to go to medical school and then a residency by joining the US Navy. So she joined the US Navy in order to make this happen for herself, to get her school covered and all of that stuff. And then she was a lieutenant commander in the US Navy for a number of years. And she talks all about how she had such an amazing mentoring time there and that it was really formative for her. She gives a great talk. You should actually invite her back to give her Navy talk. It's pretty cool.
Yes.
But she's gonna kill me for saying that. But I just think there's always a way. And sometimes it feels like there isn't a way, but if you want something, there is a way. Be creative. Don't take no for an answer. Put yourself out there. You're going to fail. And then you're going to pick yourself back up and you're going to keep going. I can't tell you. We joke all the time that we're failing upwards. And that is what it is. You never get anywhere if you don't try. You never get anywhere if you're not brave. So be brave, be bold, and go do what you need to do.
Yes. And speaking of staying in touch, I'm going to share Dr. Motivala and Dr. Gilad's emails, if that's okay with you.
Of course.
Please
do.
Share it in the chat. Again, I just want to thank you both for joining us today. So Dr. Motivala and Dr. Gilad are also a part of Northwell Health's Women in Neurosurgery virtual symposium series. So if you'd like to hear more from them, we definitely recommend checking out this webinar series. It's geared towards women who are in neurosurgery or who are aspiring neurosurgeons. And we talk more about these topics throughout. And I'm going to put the microsite on here so you can have access to some past webinars from the Women in Neurosurgery symposiums as well. But again, I just want to thank you so much for joining us today. You two are truly inspirational. I'm not even in, the medical field. I do marketing, and you inspire me.
Thank you for having us, Hannah.
Thank you so much for having us. It's been really fun. Thank you so much, guys.
Of course.
Be well, everybody.
Thank you. Good luck with your case today. And Dr. Gilad, enjoy your vacation. You deserve it.
Thank you.
Our brain turns, we will be back. I'm going to start the webinar again around like 9:55-ish for our next talk. So our next discussion, we will be having a spine virtual OR with Dr. Jonathan Russoli. So tune in again. You can log on like right at 10 a.m. That's when it's going to start. I'm going to end the meeting for now. So we'll see you at 10 a.m. Bye, everybody.